We have to get enough people vaccinated before this thing mutates further and before the B117, that's the UK variant, becomes the dominant strain in Kentucky because it spreads faster. This is a race, and therefore we need people willing to go in and get the vaccine as soon as possible. We've got Dr. Stack with us today for two separate updates when we get to them. The first one, though, is he's got an update on the total number of the B117 variants found in Kentucky. Dr. Stack.
Thank you, Governor. Good afternoon, Virginia, and good afternoon, Kentucky. So on the variants, remember we sequence a subset, a small portion of the total number of positive tests that we get. And there's attention to this at the federal government and also at the state government about do we grow that and how we grow it so we can sequence more of the positive tests. But that's a process that we'll work on in the months ahead as the nation as a whole works on increasing our surveillance capacity in this regard. Until we get to that point, we sequence a subset of the positive tests that we run at our own public health lab here in Frankfurt. And we also get samples from certain other laboratories when we have outbreaks in certain settings, like the nursing home outbreak we had in Eastern Kentucky that I talked about last week. So what I want to share with you today is that we now know that in at least 15 counties across the state, we have found these variants, the predominant one being the B115, which is the variant that's associated with the United Kingdom. There's also some of the South African variant as well. The national public health experts had said that they thought by springtime, the United Kingdom version, the B.115 version, could be the predominant strain in the nation because it transmits more easily than the original strains. Now, the reason all of this is important is the same thing I talked to all of you last week about. The vaccines are our exit strategy. The vaccines are the shot of hope that get us out of this mess and get us back to our lives safely and as fully as possible. So it's really important that everybody takes a vaccine as soon as you have the opportunity. And as the governor just shared, opportunity is more abundant now than it has ever been before. And as the federal government expands supply of vaccine to more pharmacies and more federally qualified healthcare centers, and as we then have more resources in the state level to supply other locations over the next 4 to 6 or 8 weeks, it means that it's going to get easier and easier for you to get a vaccine closer to home and from a clinician that you know and you trust, so that if you have questions, you have the opportunity to ask those questions and feel comfortable and secure in getting the vaccine. So back to the variants, what we found in the Eastern Kentucky nursing home is that it precipitously dropped the amount of symptoms people had, even if they had the infection when they were tested. And it also dramatically protected people from going in the hospital and suffering consequences as bad as death. So please, when you have a chance, please get your shot of hope. It's a shot of hope for you individually to keep you safe. It's also a shot of hope for your friends, your family, and everyone you care about, because if we allow this virus to spread too rapidly by not getting vaccinated, it has more and more of an opportunity to mutate and to change. And sheer blind luck will ultimately help the virus to learn how to be more effective by pure random chance. It'll get more effective and it will still pose a big danger to us. And in some states, they're already beginning to see the uptick of new case counts already. So we really, really can't afford to be cavalier about